Good evening, everybody. How are you? Good, thank you. Good showing tonight. Appreciate you all coming out to the Chico Veterans Town Hall. I'm Will Martin, and in addition to being an Army veteran, I'm also the Public Affairs Director for VA Northern California Healthcare System. We really do appreciate you coming out tonight. There's a lot of ways you can give us feedback about how we're doing as a healthcare system and as a clinic, but it's this in-person local feedback that really helps us the most. So appreciate the great showing out tonight. I want to start also by thanking Candace Fleming and the Fraternal Order of Eagles for giving us time here in the hall. Also like to mention that we have to be done at 6:30 because there is an event right after us. So we'd just be aware that we're going to end the town hall at 6:30. Before I ask the VA representatives to introduce themselves, I want to go over a few of the housekeeping details of how the meeting will actually proceed. The most important information for you, there's the restrooms right there, and there's food in the back as well. So cookies, water, coffee, please help yourself throughout the meeting. Just feel free to get up. Also, we do have a question and answer portion of the town hall. And when that time comes, I'm actually just going to call off numbers and have the veterans come to the mic. If you need me to come to you for whatever reason you're not able to get to the mic, we can do that as well. If you need a number, Bianca has a stack of the numbers now, so feel free to raise your hand at any point. She can come to you and actually bring you a number, but that's how we'll proceed through the question and answers. Other than that, I would ask that you just limit your questions to 2 minutes. As you can see, we have a lot of folks here. We want to make sure we give time for good responses from the VA leadership, but want to limit your questions to 2 minutes, please. And with that, I'm actually going to turn it back over to Director Stockwell and let the folks here on the panel introduce themselves before we get started.
Well, good evening. I'm David Stockwell. I'm the Medical Center Director for VA Northern California Healthcare System. We're a very large healthcare system. We have 11 sites of care where we provide VA care in Northern California. From Oakland is our southernmost point. We have an outpatient clinic and a behavioral health clinic there, all the way up to Wairika is the northernmost clinic. So there's 11 of them along the way. Our Chico Outpatient Clinic is one of them. I'm physically located at Mather at the acute care hospital in Sacramento, and I've been the medical center director since 2013, so about 6 years as the director of the healthcare system. I'm thrilled to be here tonight with you. Every quarter, we have a veteran town hall meeting somewhere in our healthcare system, and I think it's been maybe 2.5 years since I've been to Chico. With 11 sites and once a quarter, it takes a while to circle back to different communities, and so thrilled to be here with you tonight and be able to dialogue with you. Before I make a couple of opening comments and then we open it up, because really a veteran town hall meeting is about us hearing what's on your mind, what questions you have, and being able to dialogue. But I wanted to introduce my other two colleagues that are here with me, so I'll actually let them introduce themselves, and we'll start with Dr. Catherine Bucher. Not sure how that thing works.
Good evening, everyone. I am the Associate Director for Patient Care Services, otherwise known as the Nurse Executive of the Northern California VA Healthcare System. And while often nursing is not the focal interest of complaints, they're oftentimes the ones that we hug. I am also a part of the senior executive team and very interested in helping assure that we have answers to your questions about any aspect of our healthcare delivery program. So very delighted to be representing the clinical side of the house tonight.
Good evening. I'm Lori Strohecker. I'm Chief of Primary Care for Northern California Healthcare System, and I kind of try to travel around to all the clinics, which keeps me pretty busy. I've been in the position, it will be 2 years at the end of May.
Well, as you can see, I have a doctor on one side, a nurse on the other side. So any of the questions that come up that are clinical concerns, and I'll be leaning on my colleagues to help make sure that we get you the information that you need. I just wanted to start the meeting tonight and talk about sort of what's happening with the VA, what's going on here in Chico in particular with our clinic, with our new clinic that's coming our way in short order, and just talk briefly about some things that are happening for all veterans as it relates to VA healthcare and how that process is going forward. I hope most of you know that we've been in the clinic that we're at. It used to be an old UC Davis clinic before the VA moved in. We had briefly opened healthcare operations somewhere around 1996 or 7, I think. Our first provider, and actually, I think Karen has retired now. Karen Stotts, she's still there? So she was one of our first providers over at the vet center before it also moved to our current location. But we've been there a good 20 years, and we've outgrown that clinic. So from 20 years ago with one part-time provider in the vet center to the operation that we have today, it's really a testament to the needs for veterans that are here in Butte County, in Chico. It's a growing community, and we're happy to be a part of the ongoing expansion of VA care. We've been keeping track of how many veterans we're providing care to, and that number continues to grow as well. I think most of you know that the veteran population in Northern California is actually declining right now. So the passing away of World War II era veterans is at a faster rate than brand new veterans coming back from Iraq and Afghanistan and current conflicts is. And so the total population of veterans is going down. But in the midst of that, the VA continues to provide care to a greater number of veterans every single year. We continue to add, so the population is going down, but the volume of veterans using the VA continues to go up. I'm sure that's for a variety of reasons, like how expensive private sector healthcare might be, what other options, or whether an employer-covered insurance plan that used to be there that isn't there. But I'd like to think that some of it is because veterans are known at the VA, that there's a sense of community with other veterans who have been on a similar journey, that the care teams that we have at the VA are uniquely positioned to understand some of the challenges that veterans have, and that the quality of care that we're providing is good. And so I guess we'll get to hear some about that tonight from you folks. But I wanted to just talk, besides our new clinic, it's scheduled to open. I think they're going to give us the keys. At this moment, their range of when the contractor is completely done and hand the keys to the VA is sometime between May 7 and May 21. So just in a couple of months from right now, they're going to hand us the keys and be done with the construction piece. When they hand us the keys, the building is empty. It's not furnished at that point in time. We haven't hooked up all the computers, the telephone system, tested the medical equipment in the environment. And so it's going to take the VA probably 8 to 10 weeks to not only kick the tires and make sure the faucets work and we understand how to adjust the heater, and but that we get all of our equipment into the building. And so I think we're targeting right about the 4th of July to actually physically move our clinic away from the Cohasset Drive location over to the new clinic. And if you've been at our current clinic, you know it's really 3 different locations. They just kind of sort of share a parking lot, as long as you're paying attention to what cars might be driving through the parking lot to get between the 3 locations. So we'll consolidate into the building, the new building. The new building is about twice as big as the 3 locations we have right now combined. So we're going to double the size of the clinic. If any of you have been up to our Redding clinic, up on Hartnell Avenue up in Redding, it's about 55,000 square feet, that building, the main building. We have multiple locations in Redding now too, but the main building is about 55,000. This building is 42,000. So it's fairly close in size to the existing Redding clinic, to kind of give you a perspective of what's that going to feel like compared to where we're at today. There's a few new services that we're going to offer at the clinic that we haven't had available to veterans at the Chico location. So we're going to add physical therapy, and so it's going to be available on site with VA physical therapy team to provide those services in the clinic. We're going to be offering eye care for the first time at our clinic here, and so optometry needs are going to be available at our clinic. Technology is actually changing on how hearing tests work. And the requirement to use one of those booths where, you know, you go inside the booth and then you have to raise your hand when you hear the beeps and whatnot. There's some new technology, sort of looks like a R2-D2 robot that can be with the patient, and the audiologist is actually remotely in another location. And so we intend to offer audiology services, not with a booth. And so not every test can be done that way, but a large portion of them can. And so that'll be some new services that we'll offer at the clinic here in Chico. But we're going to get to grow as well. So our capacity for primary care at our new location will be better. Our integration between primary care and mental health is going to be in the modern structure. So as you know, in our clinic that we have now, they're actually in separate buildings from each other. The mental health clinic and the primary care clinic are physically separated by a parking lot. And one of the things we've noticed in VA care is that sometimes veterans have some resistance to get mental health care, even if they might need mental health care. Some of the stereotypes or their military career or just perceptions and things like that. And so we found the closer we can integrate a holistic care treatment plan, so the veteran comes, they're in an existing exam room, and whatever they need, we can bring right to them right in that room without having them shuttle across a hallway or make an appointment for a future day and hope they're going to keep that appointment. And so our new clinic will have a more integrated approach between primary care and mental health in it as well. So that's what I can tell you about our new clinic. We're really excited about it. It looks beautiful on the outside. I tried to go actually walk on the inside of it this afternoon when I got to town, and they haven't actually put the door in yet. So there's a giant cardboard section, and it's sort of nailed, and so I didn't venture through there. I didn't want to create a safety hazard for the construction workers, but we're going to be looking forward to seeing what it looks like on the inside as well. So that's what I wanted to tell you about the new clinic here in Chico, and sort of what services you could expect that we'll have here. I wanted to just briefly touch about another significant change that's coming to the VA. Many of you may know that a year ago, the Mission Act was signed into law, and that created the permanent benefit of being able for veterans to have an option to choose care outside of the VA rather than inside the VA under certain criteria. And many of you have experienced the CHOICE program and some of its challenges and travails over the last almost 5 years now. It was August of 2014 when we started the CHOICE program. And the Mission Act replaces the CHOICE program. So the CHOICE program goes away literally on June 6th of this year. And the Mission Act is the permanent legislation and benefit package that allows and gives veterans an opportunity to choose care either inside the VA or outside of the VA. And some of the important differences in the new act from the CHOICE Act, I thought I would just briefly touch on for your awareness tonight. And one is, under the CHOICE program, the VA contracted with a third-party administrator. TriWest was the contract vendor for us here in Northern California. And if a veteran met the criteria to be able to opt for care in the community, the VA would refer them to TriWest, who would then coordinate and schedule the appointment on behalf of the veteran with a contract network provider within their system. This created a lot of challenges for the veteran, for the vendor, for the VA, and for TriWest, actually, because these handoffs could get confusing, and we wouldn't know when a veteran had an appointment in the community or didn't. Or sometimes a veteran would say, oh, I have to wait 31 days for my appointment. That means I'm eligible to go to the community. That's great. I've heard all about that program. I'll go ahead and not wait 31 days. I want to go to the community. And by the time the request made it to TriWest and they answered the phone and they coordinated, it turns out that their network appointment in the community is 64 days from right now. And the veteran might have thought, if I would have known that up front, I would have just kept the 31-day wait in the VA rather than opting for Sometimes the veterans come back and said, hey, can I still have that appointment that you said was available 31 days from that moment? And it's already taken by another veteran at that point, and so it's created a lot of hassle. Under the Mission Act, the VA schedules the appointment directly with the community provider, not a Tri-West third-party administrator. And so that change takes place on June 6th of this year. And that actually not only helps us coordinate the care, it helps the veteran know, well, how far is the wait in the community, and how far am I expected to travel to get to that community provider? And so it's a more knowledgeable choice about whether they'll opt to stay in the VA or go outside into the community to get access to care. It also changes the standards. So the Choice Act had this 30 a day and 40-mile rule. So if you lived more than 40 miles from any VA, and we do have some veterans, we might even have some in the audience here tonight, that live further than 40 miles from the Chico Clinic or the Redding Clinic or the Wairika Clinic or the Yuba City Clinic. And if you happen to draw all those 40-mile circles around our clinics, a fair number of veterans were automatically eligible to go to care in the community, but only if they lived outside the 40 miles radius of any VA site. So if you needed to see a cardiologist and you happened to live within 39 miles of the Chico Clinic, even though we don't have a cardiologist at Chico, you'd still have to go to Sacramento to get access to your specialist under the Choice program. Under the Mission Act, any veteran that has an average drive time of more than 60 minutes from their home to the site where the care is available within the VA will be eligible to opt out for that appointment and get a community care option rather than come to the VA. This is actually pretty significant for every veteran at our Chico Clinic, because our Redding Clinic is more than 60 minutes average drive time from here, and so is Mather and McClellan. And so the VA will no longer be able to require a veteran with any specialty care appointment to have to go to the VA rather than have the option of going directly to the community for their specialty care that isn't available at the VA. So we have some specialty care that's available, but not the full array of services. And so that opens up a whole new set of options for veterans in the area. It's a 60-minute drive time for specialty care. It's a 30-minute drive time for primary care and mental health. I joked with the director of the Los Angeles VA that they're right off the 405 freeway in Los Angeles is where the VA hospital is. And I said, you're just going to have to like spray paint, you know, your campus property, and anybody that lives offside the property is more than 30-minute average drive time to get there. And so they all could choose to go to the community if they wanted to. But it's 30 minutes for primary care and mental health from your home to the location of the care. And then they changed the 30-day rule as well. So now it's 20 days for primary care or mental health. So if the VA makes you wait more than 20, I always like to tell people it's if you're a brand new patient, it's 20 days from today. If you're an existing patient and your doctor says, I'd like to see you back in 3 months for a follow-up appointment, then it's actually, under the Choice Act, would have been 30 days beyond 3 months, right? So if the VA could accommodate within 4 months, you still would have had to come to the VA. Under the new Mission Act, it's 20 days, not 30 days for primary care and mental health, and it's 28 days for specialty care. So shorter time frame for the VA to be able to meet that time standard, or a veteran would be eligible to go to the community. So those are some of the changes in the Mission Act. The one other one I'll mention, and then I'll be quiet, because I know you came to ask questions, not to just hear me talk about stuff that's happening in the VA, is that there's a new benefit introduced underneath the Mission Act for urgent care. And the VA's never had an urgent care benefit, any of our fee programs or historical programs ever until now. And so starting on June 6th, the VA will have an urgent care benefit. And veterans can use a network contracted urgent care provider without an authorization from the VA for urgent care needs. And the number of times that a veteran can use urgent care isn't limited under the Mission Act. However, co-pays are created after a certain number of visits. This part I always gulp before I share. It's not always warmly received because even for an 100% service-connected disabled veteran, if they go more than 3 times to urgent care, they are going to have a copay for that urgent care stop. So the benefit isn't intended to replace your primary care, to be your ongoing health care treatment. If any of you have ever been to urgent care before, they're not trying to manage your blood pressure or your diabetes or your COPD. They're just taking care of whatever problem you have that you present to it that day. They don't have your medical record. They don't know all your prescriptions. You're stopping in for an acute, unplanned need. And so really, that's what the benefit is intended to do for veterans, so that on Sunday afternoon, if you think you've come down with strep throat and the clinic isn't open, it might even be a holiday weekend, and our clinic isn't open until Tuesday, you could go to urgent care and have that need addressed without an authorization from the VA. But there are some limits before copays would come into play. And of course, if you already have to make a copay for VA care, you would have to even on the first urgent care visit. So that's a change under the Mission Act that I wanted to make sure that I shared with you. So those, I know that it can get confusing, and I'm sure over the course of the next year, we'll have lots of dialogue between veterans and the VA and the community providers regarding how does this work. I know all the pain we went through with the choice program, especially when it first started back in 2014. So I imagine there'll be some hiccups along the way. But it is coming. It goes into effect on June 6th, and I wanted to make sure I shared that with all of you. So those are my introductory comments, but we're really here for you. And I know that Will had mentioned if you had a comment you wanted to make or a question you wanted to ask, that they would hand out numbers. I'm not sure, Bianca, have you handed out? So if folks came and they said, I want to make sure I have an opportunity to speak, if you just raise your hand, she'll come by and give you a number. And then when we call, when Will figures out which numbers they are, I won't remember what number we're on, we'll make sure you get an opportunity to ask what question or concern that you may have had. And so we'll do that now. I see there's a few folks that are asking questions or are prepared to ask questions or make comments. It's valuable to me to hear the concerns that you have. Good, bad, we need to hear, because the VA is here to serve you as veterans. And if we're not meeting your needs, we need to hear about that. We need to figure out how we can partner more effectively together. And so it's important that we hear your concerns or answer your questions if there's a confusion. One of the things I try and ask people to do, and it can get difficult, is it's a public meeting, and so I don't want you to share the last 4 of your Social Security number in the meeting, and so trying to think about themes and challenges rather than a personal, particular, individual thing. I'm probably not going to fire anybody by name that works for the VA during the meeting, and so just being kind of aware that that is a public meeting. Along that regard, I also would be remiss in not mentioning that our video expert, Kingston, over here is broadcasting live on YouTube, I think at the moment, this meeting. And he may actually get questions from the video world audience that, if time permits, we may actually interject and answer some of those questions. But if you wanted to make sure that your hair was combed right, and at the end of the meeting you want to watch this all over again, it not only is he recording it live, but shortly thereafter it'll be available on our YouTube page that you can find on our internet site for VA Northern California, and you could re-watch tonight's town hall if for whatever reason you wanted to. So just so folks are aware of that, and when you're asking your questions, to be cognizant that it's being live broadcast, just so folks wouldn't get surprised by that. So with that, Will, are you going to navigate the order of questions?
We'll do it in DMV style. So if you have number 1, please come up to the microphone and ask your question, please.
Very good opening remarks.
Thank you.
Who has number 1?
No, he's there. Oh, you're prepared in case you have one. Very proactive to get the number first. It's good.
Number 2 then. Who has the number 2 card? Great.
Yes, I would like to know just how many physicians or doctors or whatever is going to be on site more than the Chico Clinic now. And number 2, is there still going to have to be, you call in and you have to make an appointment with a nurse or doctor, and last time I did, they said it's 2 weeks or more. Are we still going to have to go through that?
Okay, so I want to appreciate that, one, that you're asking how many doctors are going to work at our new clinic when it opens this summer compared to how many physicians, providers we have at our current clinic. That was question 1. And question 2 is about the process of making an appointment and how is that supposed to work moving forward. Let me ask Dr. Strohecker to comment first as our Chief of Primary Care on the number of doctors that we're going to have. And again, don't forget that we do have a psychiatrist vacancy that isn't in primary care. We have a dentist or 2, so hopefully you can cover beyond primary care. But
Right. So as Mr. Stockwell said, we're adding physical therapy and eye to the clinic, so that's in addition to what we have now. I'm not sure if all of you met our 2 new providers, Dr. Bador and Dr. Lee, if they could stand up and wave to everyone.
I see them in the back.
Okay.
Brand new physicians started a couple weeks ago.
Yeah, so they started here recently. All right, thank you. We have another opening for another primary care provider and team that's going to be added in addition to these 2 gentlemen joining us. So that's going to really open up access to primary care. The empanelment's going to be very low. And on top of that, we're actually adding a telehealth virtual provider who will be seeing patients remotely through telehealth. Some of you experienced that. In fact, I actually saw some of you through telehealth when I was in SAC some days. So we're adding that. So we're going to have quite an array of providers. I talked to Dr. Hilty, the Chief of Behavior Health, and he was happy to tell me that they made an offer to a psychiatrist that they interviewed last week. So hopefully that person will accept and come on board. As Mr. Stockwell said, we have a dentist also coming too. One of the things I'd like to kind of throw out there right now is we're going to be adding acupuncture to Chico because Dr. Lee's trained in acupuncture. In addition, I have the responsibility of training several physicians in auricular, which is ear acupuncture, so that'll add another element to it too. The other thing I'd like to mention is we have a transition of care team. We piloted this program up in Redding and then also in Martinez and Oakland. And it's a team of an RN who case manages, a pharmacist, a social worker, and now we're adding a clerical person that will help transition veterans out of non-VA hospitals back into primary care into the PAC team. So it'll be a team that'll be dialoguing with the staff in the hospital, for example, Enloe, finding out when and if you'll be discharged if you had this opportunity to be admitted, help arrange what new medicines you would have, help arrange what equipment you would need at home, and get you back into the team and get all the records so that the team has it. So we're adding a lot more.
Yeah, just how many primary care doctors are there going to be?
So right now we have MP Stats, I forgot to mention Dr. Kong Sabal is switching over to geriatrics, so we're going to have a specialty there. We have Dr. Bador, Dr. Lee, Dr. Schnur, Dr. Dorji. We're going to be adding another one, and then we'll have the virtual provider to do the telehealth. So that's the primary care.
8, if I counted that right.
Sorry.
Your second question was really about the process of making an appointment, and I wanted to cover that one. I want to make a couple of, what's that?
Having a little trouble hearing, I guess, in the back. Also, I just wanted to say there's a lot of seats open here in the front, so if you are in the back, please come forward, but it might be able to speak up just a little bit more.
All right. I rarely am accused of not having a loud enough voice. Fair enough. I want to talk a little bit about the appointment. I appreciate your question, and I think it's a very fair one. About 5 years ago, So I want to go back in time as part of answering your question. If a veteran had an unplanned need, so they didn't have a scheduled appointment already, but they had a desire to see their doctor, and they would come to our clinic, they might be told, we don't do walk-ins, you've got to drive to Redding and go to urgent care, or you've got to go to the emergency department at Mather, and we're sorry, we can't help you, come back when you have your scheduled appointment at some months in the future. And we've been working very hard as a healthcare system to undo that mentality and that culture. My expectation as the director of VA Northern California is that at every single one of our locations, including our Chico clinic, that any veteran with an unplanned but need can present to our clinic that day, and we're going to triage and provide appropriate care for either primary care or mental health. Now, I use some fancy words in there. It doesn't mean that you can get a half-hour appointment with your doctor today without it being scheduled by just showing up at the clinic and saying, I want to see my doctor, because your doctor might have a full day of appointment. They may be in Brazil on vacation that day, right? We don't know to plan ahead. But our commitment is that every veteran, every day, could present to our clinic. And so when you mentioned getting screened by a nurse, that might actually be the appropriate way to evaluate how critical is this need. Do we need to get them to the hospital? Do we need to give them an appointment with a doctor today? Or can we educate and hear their information about refilling their meds, and do they not have to see a doctor today, but can we address their needs appropriately? And so there is a triage process that involves RNs, and that it might actually be a social worker in behavioral health that does some of that triaging as well. So our commitment is there's no queue of waiting for months with no access to a provider. Any veteran that thinks they need to see a provider can walk in any day. Now, me saying that as our expectation and what happens in practice isn't always the same. So I mentioned what happened 5 years ago, and people might be told, we don't do walk-ins. And occasionally a clerk may be having a bad day, they might feel stressed, and sometimes we've gotten reports where our staff aren't as accommodating as I'm sharing right now. And so your experience that day might have been, you said that, but I went to the clinic and they said, sorry, you have an appointment 3 months from now and we're not going to see you until then. And that's a failure on our system's part. I know Ken is here somewhere. Ken, where is? There you are, standing up in the back, our patient advocate from the Chico clinic. And I know that Dr. Strohecker wants to hear about concerns as far as access as well. So no, we wouldn't expect that you would have to go to the counter with an immediate need and be told we can't see you for 2 weeks. That's not an acceptable response. It won't be, it isn't today. It does happen occasionally, not only here in Chico, it happens at Sacramento, it happens in Martinez, it happens in other locations, because we're changing a culture with our employees. And the message that we're trying to give our staff is what I tell every new employee. In fact, our 2 new doctors could probably vouch for this because they were both in new employee orientation yesterday, is that I tell all of our staff, I never want a veteran to feel like they've come to the DMV when they show up at the VA clinic. And unfortunately, some of our employees over time have felt as though they're the boss and they can not be inconvenienced by a veteran and their needs. And frankly, they have it backwards, because as the veteran, you're the boss of the VA clinic. We wouldn't be here without you. You're the reason that we exist, is to meet your needs. And so our staff need to listen. They need to find a way to accommodate and to meet those needs. Now, it isn't always, and so I did say you might not get an appointment with your doctor that day because your doctor might be in Brazil or homesick, or their car broke down. I mean, there could be a variety of reasons why that particular provider isn't available. But our commitment is, if you need care that day, we're going to evaluate and get you that care that day. Our staff don't always get it right. We keep trying to re-educate them. I think the culture is changing, and so even for those of you that have had negative experiences with our Chico clinic, if you think back to what happened 5 years ago if you had one of those concerns and what has happened recently, I'm hoping that you've noticed that there's at least a little bit different behavior along the way. Perhaps not, and we'll hear that. So I hope that addresses your question.
But when you call in just to talk to a nurse or whatever, and they say it takes 2 weeks to make an appointment just to talk to them, you know?
Yeah, so we have a telephone advice nurse. So if you call our 1-800 number that's published on our website, we have, not only do we staff with real-time advice nurses that will take the call, and I think it's an average 28 seconds wait before you get connected to a nurse. But even after the end of the business day, we actually partner with the San Francisco VA Medical Center, and 24/7 we have advice nurses available to talk. So if you call on the phone into our healthcare system, you literally in less than a minute should be talking to an advice nurse.
Thank you.
You bet.
Thank you, sir. So number 3, please.
Yes, I'm Charlie G. from Orland. I'm 20 miles west across the river in Glynn County. I'd like to say that I've been very pleased with the service here at the Chico Clinic. I do have a problem that I have to go down to Mather, to the oncology department, and they confer with Enloe where I started, which is good. The communication back and forth between Mather and Enloe is a problem at times. And I'm wondering if the new clinic is going to have any infusion therapy available here, or if it will have to be private or at Mather.
We're not going to have any infusion therapy directly inside the Chico clinic, so we'll still partner with community providers, with Enloe, or in Sacramento, of course, we do have a clinic there. I want to have Dr. Bucher briefly address some of the challenges that we've had with Enloe and some of those communications and payment concerns and authorization concerns. And so, Kathy, if you could just take a moment and talk about that.
One of the proudest moments this year for us was the ability for us to set up an emergency management approach here in Chico during the fires, and we had an opportunity to build better relationships with Enloe during that unfortunate experience that we all had. But on the positive side, we were able to actually get in, talk to the administrative teams there and the clinical teams to help better understand what are some of the obstacles for veterans getting care at Enloe. And we certainly have become humbled by the fact that we have a fundamental problem with bill paying. That's an issue that has evolved out of the CHOICE program, where the VA had a big idea and a great idea, but didn't necessarily have the structures in place in order to be able to assure something like getting the bills paid for the services that we bought from organizations like Enloe happen smoothly, happen easily. And one of the victims of that reservation on the part of Enloe was our chemotherapy purchases and infusion purchases at Enloe. If you have any issues whatsoever in getting care, or we struggle to get care with Enloe, I'll personally be involved. We have set up relationships with that team. We have broken through the barriers of those bills, I believe, and I think we're on a much stronger ground. And as we move to the Mission Act, the bill paying side of the VA has strengthened its ability to be able to be more nimble and to not put vendors at any risk in taking veterans in their care. So I just want to say that because I appreciate that Enloe has, during the fires, they also had an issue with just capacity, trying to triage patients coming, and they were magnificent in helping us help our veterans who were hospitalized. So we've had a pretty good relationship, but this has been the one sticking point that's gotten us tangled around the axle.
Yeah, I go into Enloe once a week for services in there, and it works well.
Yeah.
I just was curious if there was going to be anything else available at the new center, And like I say, communication between Mather and Linlow has been a
Yeah.
little bit of a problem, but we're working through it.
We're working
so.
through it. I will say also this about infusion and chemotherapy and oncology services. That is a very unique type of clinical care. It is a high-risk care because the medications, the chemotherapeutic agents, are very risky medications. They require the staff to have meticulous standards of care. They require a full team of pharmacists who prepare those medications under very strict conditions.
Yes.
The infusions itself, as you well know, with the Mather team, they have to be certified to do that special work. And so we find ourselves needing to centralize those services because of the intensity of that experience. In fact, last week we had our Joint Commission survey, our triennial survey. We did extremely well, and they pored over how we did our oncology services. They were very interested and careful with making sure that we were following those standards absolutely to the letter. So that's one of the reasons we're not going to open up another center here. But thank you.
Thank you.
Yeah.
Sir, number 4.
I'm a Korean War vet, and the only thing I've been using the VA for, I have no service-connected disability, so I have a policy, a supplemental policy with my other, and it's running me around $4,000 a year, but I pay nothing when I see private doctors or go to the hospital. That's all. So I've been pretty happy with it. But is there going to, with the new services available, would it be advisable, would it save me some money, I guess I'm putting it that way, to use the VA as my primary care?
It's a great question. I try not to give people too prescriptive of advice because everybody's scenario of what you pay and what benefit you get and how the insurance works can be a little bit different. But many veterans have chosen to use the VA because there's no monthly premium. The pharmaceutical copay is usually very attractive compared to what an insurance company might put forward as far as paying for your 90-day supply of chronic medications that you have. And there's some comprehensive services that, frankly, are available in the VA that might not be available in the private sector, particularly in our behavioral health components for things that veterans in particular might be wanting to access. And so it's definitely cheaper to use the VA. One of the challenges that we'll see what this new access standard does is that some folks keep their alternate insurance because of geography concerns, right? So if you get admitted to the hospital, our closest acute care in the VA is in Sacramento. And if your family is going to be at your bedside, or you're going to try and navigate in your home community, folks might think, I don't want to risk having to be sent somewhere away from my home, and so I want to keep my insurance so that if that happens, then I at least have an option to stay, local. With the new access standards and the ability of the VA to require somebody to travel long distances, that may change as far as how that decision makes. So I don't want to give you advice. I just am trying to help you kind of weigh the pros and cons of how that might work.
Well, maybe when the clinic opens, I could just drop in and they can go over it with somebody.
I will say this. There was just a study published by the Dartmouth Institute that compared the quality of care in private sector healthcare to VA healthcare. The Dartmouth Institute has long been in healthcare a group that does these market areas, and it compares different practices and different utilization of healthcare across the entire nation. And so they did a comprehensive multi-year study comparing the quality of care in the VA to the private sector. And what they found is that the VA care was equal to or superior to private sector care in every single one of their 300 markets across the United States. And so when people are mulling over, should I use the VA or not, the appreciation of the high quality of care that the VA is providing might be something that weighs into the decision process as well.
Thank you.
Okay, thanks.
Thank you, sir. Number 5, please.
My question was
I appreciate that. I was so thoroughly, I'm still going to talk, even though you know, the ability to get care in the VA is still available. And so when I mentioned you can stop in at the clinic and we're going to triage, and if you have an unscheduled need, we're going to try and accommodate that. The VA's preference is actually that you keep using the VA, and having your medical record, knowing all the specialists that you may have been sent to, getting to see what happened when you got admitted to the hospital or not, seeing what happened last year or the year before, or how many times this acute exacerbation condition has occurred, knowing all the medications that you're on, knowing if you have durable medical equipment that you're utilizing, and all of that is available in the VA system. And so this wraparound view of the whole patient is there. And when you go to a drop-in, stop-in, once urgent care clinic, literally, they don't have any of that information. And so it's, for continuity's sake, it's actually safer, wiser to use ongoing care in the VA. So I know it's a great convenient benefit, and I'm thrilled that it is available for the first time starting in June 6th for veterans when the VA is closed or for whatever reason can't accommodate. But I'm hoping that veterans don't say, oh, this is fantastic, I never have to go to the VA again the rest of my life, I'm just going to go to urgent care from now on, because they're not going to manage your diabetes like the VA is. And when I talked about quality of care in the VA, we also compare how well we do in managing chronic diseases compared to private sector healthcare systems. We have a metric that measures 18 different either prevention or chronic disease, so hypertension or diabetes or COPD, how well we're doing at cancer screening and early detection, how well we're doing at prevention and flu shots and pneumonia shots and things like that. And there are 18 different metrics. We compare ourselves to the private sector. 7 years in a row, the VA has scored #1 in the country on every single one of the 18 measures, all of them. And so veterans are getting good care in the VA, and so sometimes this grass is greener, and I'm thrilled I get an option to go and leave the VA. I just want you to be mindful as you're making those choices that we're really proud of the quality of care we're providing as well. So, see, that was a long-winded answer to your very short question.
Number 6.
I have 2 questions. One, will dental services at all be offered at the new clinic, and does the new Mission Act change the eligibility for those things at all? And number 2, historically, along with the rest of traditional health care as well as the VA, I think that orthopedics has been a weak point of care. So how is that going to be improved in the new clinic? And especially that usually starts with an MRI. And is the CAT scan machine, is that going to be available at the clinic, or how dealt with in Chico?
Yeah, well, there are several questions in there. One, yes, we're going to have dental care at the new clinic. The Mission Act doesn't change the eligibility for dental care. So as most veterans know, there's this period of time right after you get off active duty that you can go and get dental care at the VA, or you get treatment for a service-connected condition related to your dental care, or you're 100% service-connected and you get dental care. So it's kind of a high-end option of VA coverage. Not every veteran that uses the VA healthcare system has eligibility to get dental care in the VA. But those that do, the Mission Act actually doesn't change the eligibility for who can or can't. We'll have it on site. I don't know if you actually got the, whether or not, so, and what is the answer?
And the answer is yes.
Okay. So if we can't timely provide for an eligible veteran dental services, then the requirement with that wait time standard or the drive time standard would be true, and the veteran could opt, because they're already eligible for dental care in the VA, to go to the private sector if we couldn't meet the time standard. So that was one question. We're not going to have an MRI at our new clinic, but because we can't require a veteran to go to Redding or Sacramento, because that's more than 60 minutes drive, we will buy MRI services, imaging services for veterans that need them from our clinic here. So a veteran won't be required to go to Sacramento or to Redding to get an MRI. As far as orthopedic care, one of the things that we're not going to do surgery, by the way, at our new clinic. So if you need an orthopedic procedure, either you'd have to get it in the community or go to where the VA offers if you need a total hip replacement or something like that from an orthopedics perspective. But we have a number of specialty services that either will rotate through our new clinic and have a time where they'll be physically here, or they'll use the video telehealth technology to be able to have a veteran that stays in Chico and is interacting with the orthopedic surgeon or the orthopedic team that might be remotely located in another location. So we've continued to expand those services, and we'll continue to do that at our new clinic as well. Anything that either of you wanted to add about?
No, one of the things that we may be able to add, depending on the skill set of the providers that we're adding, is we may be able to add a musculoskeletal clinic, where if you need an injection, you wouldn't have to travel anywhere. We could do it within the clinic. And so that's something that we're looking into.
Okay, also, David, I appreciate your comments about the quality of VA care compared to everybody else. And, of course, I still have Medicare basic $113 a month coverage, and I have kept that because of uncertainty about what can be covered and not. And so far, I've felt that's worth it to have that insurance, but you might comment on that as well.
Yeah, just like I told the other gentleman, I try and be really hesitant to ever tell somebody, get rid of your health care insurance. Everyone has to weigh how much is it costing me, how much can I afford, and, to keep or not to keep. There are certain components of healthcare that different systems cover or don't cover. And so we've had people that are veterans that are predominantly Medicare users, and they run into a moment in time where Medicare won't cover something, but the VA will. And so they're glad that they have both, because then they can bridge that gap and have the VA provide those services. If you end up on dialysis at some point in time, and Medicare covers dialysis actually regardless of whether you're 65 years old or not. Eventually, if you're on chronic dialysis, maybe people don't know, Medicare actually covers it for even younger folks at some point in time. But copay requirements and distances to travel, the VA also covers dialysis care without crossing over with Medicare, and so there may be some advantages in the VA. I've had a number of patients that have shared with me. I had a gentleman just a few weeks ago that was recently diagnosed with Parkinson's disease. And this gentleman had not traditionally used the VA, but his private doctor told him the medication he was going to be on, and he saw what the price of the medication was, and he really quickly was running to sign up to get enrolled with the VA, because it was going to be, instead of $3,000 a month, it was going to be $12 a month in the VA. And so I think the VA is a pretty good financial deal. I think we do a pretty good job of taking care of our patients, but I don't want to personally counsel somebody to say, hey, drop your Medicare. If you end up in an emergency room and the VA has some criteria for what they'll pay for and what they won't pay for in an emergency room, and if you get caught in a scenario where the VA isn't going to cover your ER visit, those can get really expensive in a hurry, and so not having an alternate option could be risky. So you want to weigh in on that one too? Okay.
Also, I'm sure Dr. Strohecker could speak more to this than I can, but with our new program, and with our transition of care team, we've discovered by having a team of a nurse and a social worker, and pharmacists available to go into local hospitals, that not only are we following the patients we know are there because they've been pre-authorized by us to be cared for, say at Enloe, but we discover all kinds of veterans who get maybe some part of their care with us, but have used their other insurance to be hospitalized for one thing or another. And what our transitions of care teams have discovered is that once our RN is rounding and recognizes and approaches them as, with love, veteran to veteran, that oftentimes we can help that transition right back into the VA for their primary care, their medication management, rather than be discharged, even if it's under private health care insurance, be discharged and then have their spouse drive them to the clinic and say, I'm here now, what? And so we recognize that you make a decision, but you still may want that connection back to the VA.
Okay, well, I live 5 minutes from Enloe, so I guess I'm going to keep my Medicare. Thank you.
I will just share, when we had the camp fire this summer, and we had the evacuation centers here in Chico and around in the area, that we went on site as a healthcare provider, and we were filling prescriptions literally at the evac center. We were replacing glasses that got left at home, or somebody's CPAP machine that got burned in the fire, and literally as the VA was there at all of the centers connecting with veterans, I think we enrolled 118 brand new veterans that said, you know what, look what they're doing for their patients here. My hospital or healthcare system isn't doing this, and so they signed up to start using the VA. So I think we do good, but having an alternative isn't always bad as well. So, okay.
Very good. Thank you, sir. Number 7, please.
Hello, thank you for your time here. I've actually been treated by VA healthcare here in Chico for 20 years, and my care has been exemplary. Across the board, I've been treated at most of the clinics in Vision 21. The staff here in Chico is fantastic, and I've always received excellent care. Number 2 actually asked the question I was going to ask, so I had to come up with a brand new one. The new one I came up with, in years past, the VA's had a contracted skilled nursing facility. It was in Paradise. They dropped their contract, then burnt down. But there isn't a skilled nursing facility under contract with VA. The closest is in Sacramento. Is there any word on getting maybe a skilled nursing facility closer under contract?
Well, we're always looking to try and create contracts, and in fact, long-term care is a challenge for the whole, not just the VA, but the whole community can be a challenge as far as access to those beds. I think we have today 190 veterans that the VA's paying for that are in community nursing homes, potentially skilled nursing, somewhere across VA Northern California. And we're always working with contracting to try and improve. Sometimes the nursing home itself, so the VA has high criteria for quality. We do an annual inspection and evaluation of the safety and appropriate care in each and every one of those nursing homes. And occasionally a nursing home isn't comfortable with the expectation of quality and review, or if you ask them, they might say it's such a hassle, they expect or ask so much of us that it's not worth it. And so we do have vendors that will come and go from our contract relationship. But we're always looking to grow that. So I can't tell you the specifics on we're in negotiations with this particular nursing home at this moment in time, but we're always trying to grow that network and make sure we can meet the needs of veterans. So I appreciate the question. I can't answer the specifics on it though, and I don't know if you know that. I'll be really impressed.
I don't know the number. I do know that we have during the fire we actually did follow very intensely where our patients who were in that contracted nursing home, where they went, and whether they got to safety, and where they were placed, and whether they were healthy, and then I know that we have now dispositioned them for permanent placement somewhere. So there were a handful of them.
When Redding had its fire earlier in the year, the car fire, one of the nursing homes was evacuated, and it had some VA contracted patients, and they literally stood up the nursing home at the evacuation center. And so in the gym, sort of on the other side of the gym, they literally were running their nursing home at the evacuation center, and it was quite a challenge. And we were able to address the needs of our patients. We relocated a couple of them to other VA long-term care facilities as part of that process as well. So I know we didn't really answer your question, but you only dreamed it up after your first question got asked.
It was the silver medal.
Okay.
Also, just a side note, I was a work study at the Chico Clinic back when it was on Main Street and helped them move to Cohasset. It's nice to see that the clinic's now moving from there. It's amazing to see how much it's grown over the years. When they moved into Cohasset, it was literally a hallway and the building was empty. And now it's packed brim and having to move to a bigger facility. It's great to see the clinic grow so much.
Well, when Karen was our only provider when we moved into the clinic here. So I actually worked for VA Northern California back then too, and I remember when we moved from the vet center space over to the new. It was a UC Davis clinic right before we moved into it.
They built it. That was there for a couple of months and left.
Yeah.
So it's vacant basically.
Right. We've taken good advantage of it for the last 20 years. Okay, thank you.
Thank you.
Number 9, please. Oh, did I skip 8? Slack it. Hold on, number 9. Great.
I want to echo the gentleman's statements. The Veterans Administration has been great for us. My husband had a stroke a few years back, and also recently a heart attack this year, and or actually very end last year. At any rate, we ended up in both cases going to Enloe, emergency, obviously. So we ended up also, because we have private insurance that we've continued, and so we ended up paying for it out of our own pocket. So how in the future is this going to work? Can you kind of expound on all that and let us know?
It is complicated, and one of the factors is that the hospital, when somebody comes to an emergency room at a hospital, unfortunately, one of the first things the hospital is trying to do is to figure out who's going to pay for this episode of care. And hospitals have preferences on who they hope might pay for the care, whether it's a different rate or how fast that other carrier might be. And for VA care that goes through an emergency room that isn't planned, obviously, and you show up and you're wondering if the VA is going to pay for the care or not, one of the requirements is how many hours before the VA is notified that in fact a patient has come to an ED. And the patient can tell the VA that, or the hospital can tell the VA that. What unfortunately happens some of the time is that the patient might say to the hospital, I'm a veteran, bill the VA. But the hospital might think, I don't really want to bill the VA, they take forever to pay. Are there any other options? And so they don't notify the VA. Then later, they end up in a scenario where if it goes really bad, I shouldn't be creating problems. People are going to get mad when I talk about them, but you know, the other payer doesn't pay. They bill the veteran directly for the care, and all of a sudden the veteran's caught in a scenario where, what do you mean the VA wasn't notified timely? I told you to tell them. The VA says, well, we can't pay because you didn't tell us, and the other third party isn't paying, and a veteran gets stuck in the middle. So one of the things that we're trying to do to help with that, and I'm not sure, Ken, you might, Ken's still here, yes, hiding there in the back, if we have these in Chico or not, but we developed an actual wallet card for a veteran that tells them, here's the phone number, here's how much time you get, here's who you call and notify, so that it alleviates that concern that, oh no, I'm going to have my house repossessed because I had an ER and a hospital stay, and somehow the VA is not going to pay for it. And so we're trying to partner to give the veteran, here's what you need to do if you happen to show up at an emergency room, so that you make sure that the VA is notified of that episode of care, so that it can be covered. Now, when I say it can be covered, there are also criteria in the VA, and depending on service-connected disability rating and active enrollment status in the VA, there's a few sort of administrative criteria that you have to navigate through before the VA says, yes, we will pay. But I think, to answer your question, the best thing to do, and Ken, do you know if we have those cards at Chico? The little wallet-sized cards that have the information on how to notify the VA for an emergency care? You've had them in the past, but you've run out? We're going to get you some more. Yeah. Yeah. Well, we need to get, even if it's version 1 and they're going to do a better, bigger, better, different version, we still need to get the ones that we have. And so let's make sure, as a result of this town hall meeting, that we do that. So Will and my executive assistant is making note of that. I see in the back right there, we'll get a new supply of those cards. I think it's important to partner and make sure we know. So I appreciate you.
Okay, and one more little issue.
Yes.
Or thought. As far as urgent care is concerned, i.e. you have the flu or you have a sinus infection, something like that, and the VA is closed, the local one, are you saying that you could go to an urgent care?
I have to be careful how I said
Okay.
it, but I qualified it. So not until June 6th.
Right.
That's when the new benefit takes effect.
Mm-hmm.
And it has to be a contract network urgent care center.
I see.
And so we...
Because there's only a couple
This is
of
complicated.
options.
Remember, I work for the government, so when I roll my eyes or say it's complicated, at least there's some level of appreciation that might be true. Currently, the VA is awarding a new third-party administrator contract. So the one we have with Tri-West right now through Choice, that contract is sunsetting, and they're awarding a new contract. They haven't awarded it yet. June 6th is going to get here before the new contract is in place, which means there is no network of urgent care providers at this moment in time. So we've asked Tri-West to try and build a temporary network of available urgent care centers. I don't know how successful they're going to be at doing that. So the key for the urgent care part about just going to urgent care is by June 6th, get the list from the VA of who are the network urgent care centers, and those are the only ones that you're permitted to go to under that benefit.
Great.
I
Okay.
can't give you the list today because we don't have it at this
Well,
moment
it's not
in time.
June 6th yet either, so thank you.
Yeah, we would like to have the list now, but
But you asked Ken to speak up louder when he's given an answer from the back of the room.
Ken, can you talk louder when you answer from the back of the room? Thank you.
All right, so we only have about 20 minutes left, and we're on number 9. Come forward, sir.
How many numbers do you have?
13. So
Okay.
Yeah, for anybody that don't understand, we're all deaf from the war. I can't do shit back here. But I'm a Marine, I don't need no goddamn microphone. Had it not been for the grace of God, when I got home from Vietnam and out of the Marine Corps and discovered medical marijuana, I wouldn't be standing here today. So my first primary care duck, it's not polite to call him a quack, so I call him my duck. I got my letter of recommendation to use medical marijuana. I took it in, and the doctor also gave me a prescription for Marinol, which is a synthetic THC. He said that would tide me over until my crop came in. So I give it to my primary care doc, and he plugs it into the computer, and he looks at me and goes, my God, do you know what that stuff costs? I go, no, as a matter of fact, I don't. Doc, why? Is it coming out of your pocket? Well, what's this supposed to cure? Your multiple sclerosis? Your PTSD? Your prostate cancer? Who's the doctor in the room here? I hope it cures all of it and gives me a 12-inch ache. That's it. I can't stand this anymore. I'm out of here. Another thing you people don't understand. Every 100 soldiers, there's one combat veteran. Even your psychologists only have book learning on post-traumatic stress. It's no longer a disorder, it's a condition. So it's kind of hard to go in for help when you got people that don't understand what's wrong with you. March 21st of last year, I had my hip replaced at Feather River Hospital on the Veterans Choice Program. Everything went fine until week 6 when I dislocated it and called an ambulance to take me to the hospital to put it back in. The VA wouldn't pay for that because it wasn't pre-approved. Damn, I wish I'd have known 2 weeks from the time my hip went out so I could have made an appointment. It took the VA 1 week short of a year to pay the bill to the ambulance company. They still haven't paid Feather River Hospital. But Mr. Baker will tell you, because I wanted to see him, that the hospital told me that what they do is they charge Medicare if you have it. And then they keep charging the VA. When the VA gets around to paying, they pay back Medicare and pay me back my 20%. Well, that's BS. Because there is a government rule that no 2 government agencies can pay on the same bill. So somebody's blowing smoke somewhere. So she said, well, we just have to turn you in for collection. I said, I'm 72 years old. Do you think I give a rat's ass about my FICA score? What in life is there left to buy that I need a good credit for? My funeral? I'm not excited about that. I ain't paying for it. I had my hip replaced. I had that. Then my hip just never got better. But it did. It was my back. And I went to Travis Air Force Base, and what a breath of fresh air that was. My God. I've never been so disappointed in being an American as having that red-headed draft-dodging SOB that calls himself my president. I was equally as proud to be an American when I went to Travis Air Force Base. Every state in the United States is represented by a kid in uniform down there, and most of the countries throughout the world. And they are the best of the best. I was treated like a king down there, unlike every VA facility I've ever been in. Now, I do know guys that say they swear by the VA and their doctors and everything else. God bless you. That's the way it should be for everybody, not just a few. So, I got my back done, and this is what I'm really up here for, is to show you this. Another highly guarded secret in the VA system. I drove down there on a Wednesday. They put me up in a hotel on the base, no charge. Went to the hospital, had my surgery, and Friday morning they said, okay, you can go home now, but you can't drive. What? Well, don't worry, we have a shuttle for you. And this shuttle, I only have one card, but it's NAVARRE Corporation. And the nicest guy in the world picked me up at the hospital. I live in Cherokee. Dropped me off at my front door. 2 weeks later, when I had to go back down and get the staples taken out and get my car, kid pulls up at the door, 6 o'clock in the morning, picks me up and takes me down and drops me off, and I got my car and drove back.
All right, we're going to go.
I came to hear the gentleman up there, not your personal stories about all
Thank you. So number 10, please. We've only got about 10 more minutes.
Well, I know you have anybody who wants to know about this, all you have to do is have your primary care physician make an appointment for you, and they will pick you up at your door and take you where you need to go.
That was good, Tom. Damn good. I'm a stubborn, hard-headed jarhead. I was wanting to talk primarily to represent a whole bunch of other guys that can't about the phone system. But first, real quick about the triage thing, when you said that, because the hard way I had to learn to make sure at the hospital when I had an emergency, cutting the thumb off or breaking the leg or whatever, that they billed the VA. And if you're not hard on them, as he said, they'll get your Medicare and they'll get any other insurance they can. And but one of the things that why I became a Marine in '68, one of the things that sold me on it was that if I survived everything and I had an honorable discharge, I would be set for the rest of my life medically. And I thought that was kind of like the icing on the cake to me. But it has deteriorated as what we were supposed to receive since then, but that's a long discussion there. So anyway, I want to say I've been treated like a king down at Mather for my surgeries. And will this new clinic with the triage be able to take veterans that lose their coordination, break a leg, bust open a head, or just need stitching? I mean, when I went to the center one time bleeding with a pretty good laceration and I needed stitches and they were open, it was seeing the sight of the blood and whatnot that luckily we were able to get the compress on and get it stopped and put butterflies on it and it worked, okay? But will they be able to stitch? Will they be able to set fractures? Will they take care of this triage?
Okay. Yeah. So the care, it's not going to have an urgent care center. So for major emergencies, life-threatening emergencies, things that become life-threatening emergencies, things that you would need emergent surgery for, we will not be able to do that. That you would need to go to a hospital ER for it. If you come in with a laceration and there's different lacerations. I won't get into the gory details here, but if you have a laceration, you can see the tendon, then you need to see a specialist, and coming to the VA clinic is not appropriate. If you have a laceration and you're able to put a compress on it bleeding and it's fine, then some of the staff might be able to suture you up. But if it's majorly life-threatening, we want you to go to the emergency room because there's valuable time there.
So then we're going to have to go to Mather.
No, we'd want you to go.
Or go to
we want you to go to the closest place to not waste time.
Okay.
And that's why we're working on these things, trying to get the cards. And as Dr. Bucher mentioned, with the transition of care team, we're trying to get our staff in with NLO and talk and build better communication in hopes that maybe this stuff will clear up. I can't promise anything, but that's the goal and that's what we're working on.
Okay. Now, my thing about communication, okay? Anybody here that has PTSD has probably had this issue with the phone systems, okay? I broke a damn phone at home once because I called and I was trying to get through to talk to a specific department that they would keep transferring me, and I kept getting sit on a loop and bumped back to the basic one. Well, the third time, so much for that phone. And one specific current one that needs to be addressed sooner than later is urology in Mather, okay? You call to set an appointment, they have their automated thing, and it's going to be 1 in 100 that they answer the darn phone. Well, when they call you back, and I've had this happen personally, they called back and I didn't get to the phone until the message on my machine was answering. And I was calling them back within 2 minutes. And I got the automated crap, okay? I didn't get a live person. You will not call that 916 number down there and get a live person. And I want to know why. They just called 2 minutes before, 10 minutes before. Why can't they pick up the damn phone and at least say, hey, we're going to put you on hold. We'll talk to you in a moment. If it's threatening, call 911, blah, blah, blah.
I'll just briefly answer because I know we've got a couple more folks that have questions. But when I came to Chico a few years ago, there's a veteran advisory group that meets at the clinic. One of the individuals is actually here tonight somewhere. I won't point him out because now I'm going to talk about the group. But they told me about this loop right, where you call the clinic and you get stuck. And so I said, are you serious? Give me the phone number. So they gave me the phone number, and I called it. I called it all the way on my drive with my hands-free device back to Sacramento. And you're absolutely right. It was a loop. Literally, it was maddening. We actually fixed it right then, and there is not the eternal loop. We're actually moving more and more of our clinics to an actual call center, and we're measuring every day how many seconds until a human answers the phone. So you don't leave a voicemail message, you don't play tag. And for our pharmacy line, for our scheduling line, and for our operator line, it's now under 30 seconds of waiting in the queue, not leaving a message, and then during business hours, a human is talking to you about your appointment. Not all of our clinics have converted to allow this call center to schedule their appointments, but we're moving more and more of them, including mental health. Only our Sacramento site currently has where you call the 800 number, not a 916 number, and a human talks to you. We'll look into urology in particular at Mather, so I'm glad that you mentioned that, and I see my EA is making note of that particular one, if we can move that to make sure a human answers. So thank you for sharing that.
Number 11, please. All right, number 12.
Hello, please excuse my excessive coughing this evening. I completely concur about the call system. It's been so frustrating over the years not to be able to reach a real person. Once you get in the door, for whatever your issue is, my experience has been pretty darn wonderful over the years, and I'm happy with the VA. Disappointed that I wasn't told that I could be eligible for benefits until I had spent over $100,000 on private health insurance premiums because I was self-employed. And the only reason I learned I was eligible is I was shopping at the Home Depot, and the customer in front of me asked for a veteran's discount. And the cashier, when I got up, I said, I'd like a veteran's discount. And she said, go to the clinic, get your ID card, and you can get a discount. So I go to the clinic and they said, well, you can have an appointment such and such a date. I said, well, I don't need an appointment. I don't have any health issues, and I'm not in the system. I just need the card. Oh, well, you have to have an appointment to get enrolled. And so now, 15 years later, I have saved so much money on health insurance, I can't believe it. But the ball was dropped by the VA because nobody told me that I was eligible for benefits. The other issue to do with the phones is that when you're actually talking to a person and you're trying to coordinate some care issue with another office, they don't have the phone numbers. I had an issue, I met with an audiologist in Chico, got prescribed hearing aids, said, I'll order them for you. They should be here in 2 weeks, and we'll set that appointment. Well, the audiologist position became vacant. And so they had the hearing aids in the office and couldn't give them to me. And I said, all I have to do is put them in my ears. They said, no, sorry about that. You have to be fitted. We have to verify the adjustments. I understand that. So we can send them to Redding, and you can go up there to the audiologist and be fitted. I said, great. It took like 6 weeks to get an appointment. They transferred the hearing aids up to Redding, and then I received notice that there was an audiologist hired for Chico. They said, okay, well, send the hearing aids back to Chico. I said, well, are you sure you can see me and get the hearing aids here in time? Oh yeah, we'll put them on with the van driver and he'll bring them down right away. So I kept my appointment I received a phone call the morning of my appointment, and they said, we're canceling your appointment because we don't have your hearing aids. Okay, so then I went into the phone system. I'm trying to figure out where my hearing aids are. I spent all day trying to track it down. Nobody knew where the hearing aids were. So then I said, well, if I'd known they weren't going to come down here, I would have gone to the appointment in Redding. I have to reschedule. So Redding, the appointment was going to be 4 more weeks out. And
sir, I don't mean to be rude, but we only have a couple minutes left.
I understand. Okay. It turns out my hearing aids were in Chico and they didn't know it. Somebody had put them away and they didn't know where. So my issue with the phones is specifically that individuals in the VA offices don't have access to other VA phone numbers. Because I was asking in Chico, well, can I talk to the person in Redding? Because I was trying to track everything down. We don't have their phone number. That what? Anyway,
Yeah.
I ended up talking to Martinez and San Francisco, and I ended up having an advocate at Martinez that helped me, but the people can't get phone numbers within the VA system. That is a major problem, because communication is primary to mission.
Yeah, I appreciate, it's a sad story, and we definitely screwed up in trying to get you your hearing aids, and I hope we have got them for you at this point. You're just reliving it with the pain of trying to get a hold of us. But your comments about knowing the phone numbers is good info. Thank you for sharing.
Number 13, please.
13, that's the total? Okay, okay, okay.
All right, my question is, I started out in Chico, and I wasn't satisfied at all. So I transferred to Redding, and I have never been happier in my life. I mean, anything I need, I can make a phone call. If it's an emergency, they get me right in, one way or another. But my question is the new facility going to be as quality of Redding?
Well, they're both our clinics.
Well, I realize that,
so I'm sorry that we didn't meet your needs before here. Our current clinic in Chico might be better than how you remembered it. I don't know how long ago you moved to Redding, but Dr. Strohecker is our chief of primary care over both Redding and Chico. And the model of how we do the care and how the nurses provide the support and how the clerks schedule the appointments is intended to be the same at both clinics, not a different universe, a different planet when you go from one to the other. And so I know we have work to continue to try and move towards that, but since Dr. Strucker has been our chief of primary care, she's made it a point. She mentioned she's always on the road. She literally is in Oakland one day and Redding the next and Chico, and she's been working very hard to make sure how are we more consistent. And so we're going to aspire to do that at our new clinic.
Are they going to be the same procedures that Redding has? See, I need a transfusion or an infusion a few years ago, recommended by my private doctor, but they couldn't do it because I wasn't on Medicare yet or whatever. But Redding says we can do it through the VA, and I did it right up there, and they did it immediately. I didn't have to wait hardly any time. And you just said that they won't be able to do infusions here.
They won't. They're not going to have an urgent care center at Chico. There is an urgent care center at Redding, so that is a difference between the two that will continue to be true.
Yeah, because I know I had a major problem here. A few years ago, my diabetes went so far out of sight, it almost made me blind. I went up to Redding, and they took my blood sugar. They said go to the emergency room immediately. And the next day, they put me on insulin because I wasn't on insulin before.
Right.
But I've been on insulin ever since, and it's not a problem getting the insulin through the VA. It comes right away. And I know that one of them I takes $800 and something a month. It only costs me, like you said, $12 or less.
Right.
So there's no problem there, but I think I'm going to stay in Redding because they got more stuff up there, and they can take care of you quicker.
Certainly your call, and I'm glad that we are doing right by you at our Redding clinic.
Right, because
Okay.
I never was happy here in Chico.
Okay.
But I've been super happy in Redding. I have never been dissatisfied at any time.
Thank you. Okay, so I want to thank everybody for being here tonight. We're trying to honor the Eagles and the use of this building that they gave us the opportunity to use, and I know they have another event that they got to set up for, so we're going to have to go ahead and conclude. But if you came out here tonight, I hope it was worthwhile, that we had good dialogue. I appreciate the feedback, good, bad, or indifferent. It's actually really important for us to hear. So thank you for coming, for advocating for other veterans, for the system, and we'll do this again. So thank you very much.